Michigan, you are watching Alive and Well, and today we are at the First Congregational Church on Jefferson in beautiful downtown Muskegon. It is a beautiful fall day out there. With me is Janet Carbonneau-Jones from Planned Parenthood of West and Northern Michigan. Is that correct?
That is correct.
Okay, and tell us about today's event, Community Conversation here.
Okay, well, because we are Planned Parenthood, we are very excited about the Affordable Care Act. And so we have worked with the Michigan Consumers for Healthcare to put on a presentation to educate the community about the benefits of the Affordable Care Act. But why is Planned Parenthood involved? We're involved because many of the people that we serve here in Muskegon are either uninsured or underinsured. And the Affordable Care Act will bring them many, many opportunities to take care of their health.
Okay, that's wonderful. So there's a focus today on women's health, that's correct?
That is, yes.
Okay, and a lot of women's health issues, and we have a special guest speaker who I understand is going to be very dynamic, and we will be interviewing Eli next. So what are some of the health issues we're going to hear about today?
Some of the health issues include family planning and just plain and simple comprehensive annual exams for women. A lot of people don't know that here in Muskegon at our health center on Apple Avenue within the health department, we serve about 1,200 women every year.
And you do cervical exams, you do breast screenings, correct?
Yes. Many of our clients, when they come in for the annual exam, that includes breast and cervical cancer screening. And we received a grant from the Community Foundation for Muskegon County to help us with our cervical cancer screening services.
Wonderful. And I bet you're very grateful. Muskegon County is very grateful for that. So that's great. So their grant, what does that provide? Does it provide the screenings itself?
It does. That grant basically is designed to save women's lives. And I mean that by if a woman has an abnormal Pap test and she needs further diagnostic care, then that grant will pay for them to find out if they have cervical cancer and or receive biopsy services.
It's so important because there are many women that aren't eligible for, say, Medicaid, or they're just on the borderline. Maybe they don't have children. And oftentimes, it's children that brings you into the group that makes you eligible for Medicaid services. So sometimes underinsured people can't afford these screenings. So it's very important that they provide this. I imagine they check with, is it a sliding fee scale, or how do they determine?
It is based on the government sliding fee scale. Okay. But often, if a woman has an abnormal Pap test or even a lump in her breast, that all of a sudden is not considered a family planning service. And therefore, she either has to pay out of pocket or go without care.
Okay, I can't go without putting in a plug for Mercy Health Partners, the Community Benefit Office, Muskegon Community Health Project, where I work. We do help people who are underinsured, and that's, they're welcome to come into our office anytime at 565 West Western, and we can help with many of those medical bills. And I imagine you have some programs also, and how can they contact you, or where should they go?
Basically, they can contact us at the Muskegon Health Department. We are open, they have to check our hours, but we are closed Tuesdays and Wednesdays, but we're open Monday, Thursday, and Friday.
Okay. So the Affordable Care Act, just give me an overview of how you feel this is going to, what kind of differences will this make for women who are underinsured?
I think it'll remove a lot of the barriers so that they will be able to access the care that they need and they deserve, so they can take care of their health and their families and save their lives.
Okay, wonderful. Thank you. We're very excited about that also. So thank you, Janet. It's a pleasure meeting you, and we're going to do a brief interview with Eli before we hear his presentation. Thanks. I'm here now with Eli Izaguirre. Did I say it right?
Yes, you did. Yeah.
You told me that you're third generation.
Yeah, we're third generation now, so we kind of let the pronunciation go a little bit. So.
How kind of you. But we should learn how to say it correctly. That's important. So, I love Obamacare. Okay, Affordable Care Act. That's great. So that's what you're talking about today, correct?
Yeah. I'm here with Michigan Consumers for Healthcare. We're a statewide coalition working with over 160 groups now to move healthcare forward for Michigan, making sure that healthcare is more accessible, more affordable, more transparent for people. So it's really working for consumers instead of against us. And we've seen that the Affordable Care Act really gives us that opportunity to really take some of the shortcomings of our healthcare system and make them work with us.
That is exciting. I'm very excited about that. I know we are at Trinity Health very excited about the Affordable Care Act. So tell me a little bit about the discussion we're going to have here today.
Yeah, well, through our work the last year and a half, we've really found that people don't understand what the law means. There's about a 50-50 split for people that support it or that are against it, but what we find is most people don't really know why they support it or why they're against it. So we found that when we go out and we do some education, really coming at it from a nonpartisan view, people really come around to our side of things. And you can't really be opposed to a law when you support everything in it. So the more people understand the law, the more they support it, the more they get engaged and can have a hands-on experience with implementation, because there's so much left up to the state that we really need consumer input on, and unless they're hearing from us or groups like us, they don't even know these decisions are being made right now.
That's very important. I really like that aspect of it because there's many things about this new Affordable Care Act that I myself don't understand, and I'm in the healthcare field, and so I'm really looking forward to learning from you today. Can you tell our viewers a little bit about your background?
Yeah, well, I came up from Michigan State University, studying political science, actually, and did some campaign work, and some of the early work I did was working on trying to get the Affordable Care Act passed, volunteering, things like that, and it's close to all of our hearts. We all have a family member, someone that couldn't get insured or went a long time period without insurance, or maybe had to go bankrupt because they didn't have insurance and had to end up in the emergency room. So it really is close to my heart. It matters to me that we do this right. We've waited 100 years to pass healthcare reform. It might be another 100 years before we get another shot at it. So we really don't want to screw this up.
We don't. Let's hope it doesn't take another 100 years. This is the first step in the right direction, and it's a big step. Yeah. And so it's going to, can you tell me a little bit about when the Affordable Care Act actually goes into effect?
Yeah, well, there's been lots of part of the law that have been going into effect over the last couple of years. Something people still don't understand is that this has been law since 2010. So we just recently passed the 2-year anniversary. So some things went into effect right away. Minors couldn't be denied coverage anymore for having a pre-existing condition. That goes into effect for everyone else in 2014. Things have just been rolling out. A lot of new benefits for women started August 1st of this year that we'll talk about in the presentation today. But the majority of the law will be completely in place by January 1st of 2014. So when the healthcare exchanges will start, that's when the expansion of Medicaid will be launched. So that's the big day, that most of the law will be implemented by then.
Okay, yeah, I keep thinking 2014, because I know I'm thinking of I have a son who's 36, and he is going to benefit from this because he's not been eligible for any, he's not low income enough, right, but, not make enough money. So affordable care is what it's about. And then I have a son in college. And so I really like that aspect that now we don't have to turn in all this paperwork every year for our college students. If they're in college and they're under, I think, 24.
26, actually.
26,
yeah.
26, that's important to know, viewers. Yeah. If your child's in college and under 26, they can automatically still be on if you have health care coverage, can still be on.
They don't even need to be in college anymore. It's one of the best parts of the law that has been the most effective. We've seen about 6 million young people either be able to stay on their parents' insurance or gain access to their coverage just because of the one piece of the law. It does away with them having to be a dependent, having to live with their parents, having to be in college. If you're 26 and under and your parents have health care that can cover you, you're eligible for it.
Even if you're not living with your parents?
Even if you're not living with your parents.
See, I'm learning myself here. I should know these things. That's so important. So 26-year-olds, we really need to know this. We have a lot of people that come into our office. Now, is that true on Medicaid too? So if the parents are on Medicaid or they have younger siblings and the family's Medicaid eligible?
I don't believe for Medicaid it will go down. It's just the private insurance that you own, and there are some retiree plans that won't cover as well. So definitely want to check that out for your own particular plan when you're looking at that.
Now, when we think of affordable care, so this means that somebody that makes maybe let's just throw out $35,000 a year or something, does it mean that they're going to have access to more affordable health care plans?
Definitely, definitely. There's a big increase in the Medicaid program that comes with this January 1st. Right now, to be eligible for Medicaid, you have to fit into one of 25 different categories and be very low income. So it's almost impossible to get on it for some people. But in 2014, like I said, Medicaid's going to be solely based on your income. It's going to do away with all of that. So it's going to be expanded up to 133% of the federal poverty level. So what that means is a family of four that makes around $30,000 a year will be eligible for Medicaid. That's a big expansion. It's looking at 400 to 600,000 people here in Michigan alone. And then for those that are just outside that, they'll be eligible for tax credits to help them purchase insurance through the health insurance exchanges. It goes all the way up to 400% of the federal poverty level. So there's help for everybody.
That's
in
what's
this
important.
law.
It's those people that are somewhere in the middle that just can't seem to get health care, and it's so expensive. I know for a while I was on Cobra a few years back, and it was like $465 a month for one person. And if you don't have much income, that's pretty difficult to do. So.
Yeah, so we're really excited. You know, it's really going to make it affordable for people. People get caught up a lot on the individual mandate. Something that they don't understand is that even with the biggest subsidies out there, if it's still unaffordable, you're not going to be hit with that penalty. So that's something people need to keep in mind as well.
That is important. That is a big misconception, and that's scary for a lot of people. But I've had that conversation with my son, and so their education about this is very important. I look forward to your presentation today. This is exciting to hear about and learn about. So thank you so much, Eli.
Yeah, thank you very much. And I'd just like to say, if people do want more information, they can check out our website.
look right at our camera.
All right, right at the camera. If you need more information about our coalition, definitely check out our website, consumersforhealthcare.org. If you just want some more information about the law, we do have another site, healthreformtruth.org.
Okay, thank you.
Thank you.
It's been a pleasure.